I'm Donna Sollenberger, Executive Vice President and CEO of the UTMB Health System, and I just finished our Mondays in March. We had a great turnout with lots of people who were interested in all of the work that's been happening across the health system and across UTMB over the past year since we last met. The presentation really focused on the fact that we are in a challenging industry. We have many challenges facing us, whether they be reimbursement, whether it be quality of care, so many things that are concerning, but also that provide a tremendous amount of opportunity for organizations as resilient and as innovative as UTMB is. Our emphasis really this year will be around continuing best care and the work that you can do in that. We talked about we really need to improve all areas of patient satisfaction. So best care is not only alive and well, we still have work to do. And we hope that you will continue the great work you've been doing, whether it's interacting with our patients or going into patient rooms to help serve the patient food or clean their room, or bringing supplies to the units or to the clinics. All of those, we need you engaged and continuing to do great work on behalf of our patients. We talked about a little trick you might use when you're leaving a room of saying not only, I'm leaving now, is there anything else I can do for you, but commenting to the patient that you have the time. Even though we may feel rushed, that alone reassures the patient that we're there for them. We also talked about it's been a challenging year financially. We've seen our volumes grow year over year tremendously, and yet we are being challenged with being reimbursed less and less for the care that we do deliver. We're not alone, and there's work though that we need to do to really bring our expenses in line with what the rest of the market is providing. And so there are great ways to do that we talked about in terms of thinking about how we deliver care differently. Things like really reviewing the lab tests we're ordering, reviewing the radiology tests we're ordering, things like that that won't change really or impact really the people on our units and in our clinics, but will help us to meet this financial challenge. And thinking about ways we can do our work better so that we can accommodate this growth. We talked about the growth at League City Hospital in League City, and we also talked about the MD Anderson project. We've said that with MD Anderson, we really are better together because we have an opportunity to tell people about the wonderful work and the wonderful people we have here at UTMB and also at MD Anderson, who can bring world-class cancer care right into the League City community, which is one of the fastest growing communities in the state. And lastly, we can't forget about our people, and we know, I acknowledged, people are anxious. There's a lot of change right now. But I would also say that despite being anxious, we need to feel confident. We have done this before and we will do it again. And we will be able to rise at the top as we did in Best Care. We will continue to rise to the top in terms of the care that we can deliver to our patients by exceptional employees that we want engaged in the work that we have to do in order to meet this financial challenge. I appreciate the work that each and every one of you does day in and day out that benefits our patients, whether it's in education and research or in patient care. And I look forward to another 12 months, which I promise you will be challenging, but I also promise you that we will come through this and we will be a stronger organization than before. We've done it before, we will do it again.
UTMB Health, working together to work wonders.